Good afternoon, everyone. I am Mayank Vaish. I am a cybersecurity and digital identity specialist. I have helped several organizations in last 20 years in setting up their digital identity program. Currently, I am working as vice president at CyberSolve, and I'm helping several Indian organizations in their digital program expansion, as well as I'm helping several APAC organizations. The topic that I want to talk about today is about the evolution of healthcare from physician-centric approach towards patient-centric approach, and how digital identity is going to play an important role in this evolution. So, how I associate myself with physician-centric healthcare. My earliest memories goes back to my childhood, where every visit to hospitals or clinics would mean doctors giving us prescriptions in paper form. The entire treatment or prescriptions would be given only in the paper records, and as patients, we were always supposed to safely maintain them. However, fast forward 20 years, have we been able to keep all those records securely with us? Actually, no. We don't have several of our medical history available with us. And I don't know, as a patient, what would be the implication of not having my previous paper records in my future treatments. So this was an era where the entire treatment was prescribed only in the paper form, and it was very cumbersome for a patient to actually facilitate the sharing of those records or data with different provider. Later, we saw digitization in healthcare, and where we saw that paper records started getting replaced by electronic records. And we saw several hospitals as well as other healthcare entities starting to adopt digital technologies. However, the primary objective was to simplify the administrative functions such as billing and appointment booking. And still we see that sharing of digital information, even if the information is now digital, sharing of those information across providers is cumbersome. Now where are we heading towards? We are heading towards patient-centric digital healthcare, where entire ecosystem is getting reshaped to help the patients, keeping in mind patient in the center of the healthcare journey, not the limitations of our system. So important point here is patient journey throughout his medical experience, throughout his healthcare experience. So what are the goals of patient-centric healthcare? The first goal being convenient access to the patients, convenient access at the convenience of the patient's home. We intend to provide electronic access to the patient at the convenience of his mobile. We are talking about e-billing, e-appointment systems, e-pharmacy. We also want to provide extended access to the patients. And this was super important, super helpful when we were all locked down in our homes. This is about teleconsultation, virtual OPDs. We also want to give continuous care to our patients. What it means is, throughout the patient journey, he should have a portable experience, irrespective of the provider. And last but not the least, we want to give an interconnected healthcare experience to the patient through a single window, through a single app. We want to consolidate all the experiences to the patient and make it as easy as possible for him to appreciate it and to use it. So this is all what we want to do in patient centricity when we are talking about digital healthcare. But how do we do it? What are the building blocks of a patient-centric healthcare? And why are we not there yet completely? So I think there are three important building blocks. To start with, availability of equipments. So equipments have to be available at both provider side, payer side, as well as at the level of patients. So with rapid digitization in India in all sectors, even including healthcare, we can say that now most of the healthcare facilities, healthcare institutes have access to good computation infra. At the same time, patients have access to smartphones, which are very affordable. So equipments are here. As the first building block, they are there now. The second point is internet availability. And this is also where we saw rapid growth in India, where now entire nation is very well connected through good quality internet and affordable plans. So even equipments and internets are available. However, the third part is the tricky part, which is about identity. And when we are talking about patient centricity, when we are talking about keeping a patient in center of the entire ecosystem, we need to recognize that patient uniquely. We need to recognize him in all the digital systems. We are talking about adopting AI, we are talking about using IoT. All of those rely on the unique identity of the patient. And if we are not able to uniquely and truly identify a patient, even AI will not be able to give a right recommendation about the patient. So while this seems so fundamental and seems that we have solved it, it is actually not solved. As an example, I would quote myself that in a very large hospital chain, I am identified by 7 different identities. I have 7 different profiles. And when I checked with my other connections, I realized it is very common that a patient would be recognized with several identities in the same hospital, or maybe in branches of hospitals under the same chain of hospital. So it is important and fundamental that we identify a patient uniquely. And for that, how do we do it? We have to look at our identity framework for patients. And we have to do it at 2 levels. We have to look at the identity framework locally at the healthcare institute and see what are the processes and technologies that may require some re-engineering. At the same time, we have to remember that a patient is ultimately a citizen. He is a human being, and as a human being, he may be availing the digital healthcare facilities across the nation. So we have to identify the patient as a citizen also. So this is where I am talking about the national identifier programs that Government of India has given, which we should leverage. I'm talking about the Aadhaar program and the Aabha ID program, which gives us the flexibility and the power to recognize a patient throughout the healthcare ecosystem in India. While Aabha identifier is recent one, it is growing rapidly. So I feel that healthcare institutes will see merit in adopting the Aabha identifier soon, even though Government of India has not yet mandated the adoption of it. So in nutshell, the revision of the identity framework needs to be done so that we can internally also identify a patient properly, and we can consider the future adoption of Aabha identifier into our ecosystem. That is also a second reason for us to review and re-engineer our patient-based identity frameworks. So with that, here is a blueprint of a framework which has been very effective, and I would suggest that all of us should take a look at it, should register this. In this framework, which is specific to, which can be specific to every healthcare provider, every healthcare individual entity, there would be 3 components. The base component is going to be the patient repository. Here, what we want to do, we want to create a repository of all the patients from their current repositories and systems that are dealing with the patient, that are operating on the patient identities. We create a layer of this patient identity in some database, or it can be a directory. And objective is that we unify them properly. We remove duplicate identities. We look for merging of identities, and if required, we should do KYC, we should do identity proofing exercises. But this will give us the unique list of identities that we are dealing with. And then this needs to be managed by a set of processes. A set of processes such as new patient onboarding process, a set of processes such as authentication of a process using Aabha ID, a set of processes such as patient registration and KYC, and even orchestration of a patient profile between all the internal and external systems. So a set of process is what will facilitate the right use of identities across all the internal systems such as IoT systems, EMR, EHRs, and other clinical applications. Third is a very important one. It is about a function or an engine that will facilitate interoperability of this identity within the hospital or the healthcare entity within its several digital systems, as well as it will be instrumental in facilitating interoperability with the Ayushman Bharat Digital Mission applications, because it will provide us a set of standards such as OIDC, SAML, which facilitate a technical interoperability protocol called as FHIR. So a combination of these three combinations in the identity framework is what should be considered in a identity framework in an individual healthcare institute. And this is what is going to power the channels which are meant for patients to access the BAU services of hospital. These channels are common one: patient portals, mobile apps, telecalls, and chatbots. So overall, this platform is what will not only ensure that we are identifying the patients properly, we are avoiding any duplicate identities in future. Also, we are able to give them single window experience, which is also called as single sign-on. We are also able to adopt future technologies properly and in a faster way, because this identity framework is already once set, and it is now available for any future digital innovation, any future digital application adoption by the healthcare institute. So this is a approach, this is a framework that as a digital identity specialist, I suggest, and I have used it for external healthcare institutes, and it has been very effective. Now, how do we go about it? While we understand that this is a framework that can be adopted, can there be a plan? So yes, there is a very simple 3 months, 6 months, 12 months plan, very simple steps. Let us start by assessment of our current setup. Let us start understanding what are the current processes which are meant for patient-centric operations. Let us start by understanding the list of systems which are the repositories for our patient identities, as well as which are operating with the patient identities. All of those would require assessment of the process as well as assessment of their support towards future interoperability protocols. This will help us in preparing a framework, a future framework, a framework for onboarding the patients, a framework for KYC, a framework for adopting the national identifier, a framework that will help our systems talk seamlessly between each other. And this will then help us in doing a small pilot or a prototype, which can be done with a small subset of data, which will help us understand how well the system is now integrated. And this is where even the sandbox environment that is given to us by Government of India under Ayushman Bharat Digital Mission can also be considered. Finally, with successful results and prototyping, this whole framework can be rolled out across the whole healthcare institute as a final implementation phase. So this is what I had to tell about patient centricity using a strong digital identity framework. Thank you so much. Sure. Yeah.
I think the chronology of the work is absolutely fine. The greatest challenge will come in identification of patient.
Right.
Now, let me give you an example. I have got a maid servant who has got 10 people at her home. Of that, one is a challenged child. Okay? Now, all of them have got one thing, that is ID. That is Aadhaar ID they have.
Yes.
Now, my question is, for them to create an Aadhaar ID is a major challenge. They have got one mobile for the entire family. My solution to this is that every person who's holding an Aadhaar number is an Indian citizen
Absolutely.
and is also authorized to use the government facilities or any facility.
Absolutely.
So why go and create an Aadhaar ID separately? Every person who has got a Aadhaar ID should be automatically considered a health ID also.
Yes.
That will make it much more simpler.
Yes.
Because tell me now that Aadhaar ID has been there for some time.
Yes.
How many people have actually been able to go through or download the Aadhaar app?
Yes.
Or create an Aadhaar ID?
Correct.
It is an additional feature which is very difficult to be implemented at the level of people who are working in our homes, and they are the majority of people. So my question is, why don't you suggest that Aadhaar ID, which is already existing, to be converted into the health ID? No separate Aadhaar ID.
You're absolutely correct. Bang on. In fact, Aadhaar has much bigger coverage. It has been here for more than a decade. So the message that I wanted to give was, we find a way to uniquely identify a citizen, and actually Aadhaar is even a better example. You're absolutely correct. Aadhaar ID, the only benefit that I see, and I'm not advocating Aadhaar ID adoption, the only benefit that I see is it is specifically created to support the healthcare participants, provide healthcare benefits specifically from the government of India. It is what is actually already designed to be part of the healthcare ecosystem. Otherwise, at hospital level, identifying a citizen with Aadhaar should do. It is actually already more widely accepted. Like you said, a family of 10, but they all have Aadhaar ID, very well. So there's no mandate. Point is that we uniquely identify someone, and Aadhaar is a better example. Earlier, we used to do it using phones, mobile phones, but now many people change their prepaid number very frequently, and maybe that is the reason even I ended up with several profiles. Aadhaar does not have this drawback, so Aadhaar can be easily accepted. However, we have to keep a watch on how Aadhaar ID coverage is progressing, and if people are seeing more and more benefits in adopting it, maybe in the future it can be adopted. What is important is to have a framework that I wanted to highlight, to accept a identifier beyond our hospital identifiers.
Yes. What I'm saying is that when you want to enroll yourself and get a Aadhaar ID, there are only two documents that is required.
Right.
Either an Aadhaar card or a driving license.
Correct. Yes.
Now, driving license, of course, will not be there people less than 18.
Yes.
So, unless you have an Aadhaar card, you cannot enroll for an Aadhaar ID.
That is correct.
So, Aadhaar ID will always be there.
It is the universal.
As the starting point.
Absolutely. Yes.